right, welcome back, gentlemen. Order. I can say order on the table tonight. Order, Dr. James Nikal, Dr. Miskela, and Dr. Matende Chero. Thank you so much, gentlemen, for coming. Tonight is a lot to talk about. We left this discussion hanging. I was vilified and crucified by the doctors for not having their side of the story. Then, interestingly, the CS for Health, Susan Nakumicha, said on the table that, we're not averse. We can come and sit with the doctors. Now, tonight she's not on the table, but the government is represented. Before we begin, let's take you back in history. Let's bring up the newspaper, The Standard, 5 years to the day today, and take a look at the headline then. The headline, date to the day, just different is the year. Raila Odinga said then, Kenya will change that year. I wonder how many strides we made. But that was the headline in your bold newspaper. 5 years to the date today, Kenya will change this year. Former Prime Minister reiterates the need for inclusivity in government and an end to the divisive politics. That was a headline, but there were other headlines. I think this case is been concluded now. Brutal murder of medical varsity girls stuns the nation, and Ruto rallies citizens to get Huduma number, then as the deputy president. Now, those were the stories on the bold newspaper then, The Standard to the day today. That's history. All right, before we begin the discussion tonight also, we want to just a little bit flip the coin and begin tonight with the video of the week. Take a look.
Times, it is not just about the job that you're doing, it is also about the satisfaction you're having as you do that job. So you cannot just force someone to do a job in an environment that they don't feel is okay. And I think that is where we are missing the point, because these governors, they think that when they issue out threats and so on, then people will run back to work. What about if they don't go back to work? What about if they go away? So that by the time they're saying, okay, now let us come back to the table and solve this issue, they find that now even they've left. Some of them have gone outside the country. Some of them have gone into private practice. What effect is it going to have? So I think we really need to now become more objective. We now need to exercise leadership, because, sometimes these politicians and leaders, they don't feel the pain, because when the public services have collapsed, them and their families will still be able to afford treatment in the private hospitals. Some of them even go abroad to get treatment. So when the services have collapsed like this, they don't feel the pinch. And maybe that is why they are just insisting and holding on to the hard positions, while the very people who voted for them are continuing to suffer and die.
Well, a very good place to begin our discussion tonight, because that's where we find ourselves at tonight, because there's a stalemate. The government looks unmoved, and the union says, you will have to cede some ground if we have to go back to the hospitals. Now, this is not about Dr. Sultani, but it's about a perennial problem that must find a solution. Tonight, we try and do the diagnostic, the anatomy of this strike, and try to see who has the best prescription. Thank you once again, Dr. Nikal, Dr. Miskela, who has given me hell. Thank you so much for coming. And Dr. Matende Chero, thank you so much for coming. Gentlemen, I want to begin with that. Why is there a stalemate? Why is it that the government looks unmoved in the face of this crisis? Let me begin with Parliament. I promise, Parliament, government, and the union. Why does it look like the government is unmoved in this?
Well, I can't talk for the government now, because when you're talking of the government that is not moved, you are talking of the executive. I'm also surprised. This is the first time I've seen the government leaving the negotiation table. Quite often, it is the unions. More often than not, it's the unions that say we are leaving because we have not been over. I would expect the government to be at the negotiation table. Let the unions move, then they come, they make an offer. Because in a crisis where there is a lot of public hurt and where the people who are vulnerable are being hurt, it is normally the superior force which have the bigger responsibility that tries to be patient and to get things moving. So I can't understand why the executive is not moved. If you want a broader definition of government, so then you can bring in Parliament. Yes, Parliament, this matter there was a petition that came, and it was presented to the chair of the health committee, and we expect that next week there should be a discussion.
What was this petition from?
The petition was from the
union?
The unions that were, I think that time was mainly the clinical officers that came with it, and it came to Parliament. Somebody to receive it. The chair of the health committee received it, and then I think it goes to the public petitions committee. So I think it is there.
Okay.
But I think this is a matter that even yesterday was raised in Parliament, if you are watching, and I think even tomorrow this matter will
still come to the floor.
Will still come to the floor.
Okay.
So Parliament is aware of it, and actually I expect more action from Parliament.
Okay, I'll come back to you. Why is it that you don't want to listen to the government that is saying it's been 1 month, things are bad, go back to the hospital, let's negotiate. And even if you don't go, we don't have the money. Why is it that you don't want to listen to the government?
Thank you, Ken, for finally having me. And I hope I will give justice to my members who are eagerly watching. So first of all, Ken, to understand the context upon which we find ourselves in this crisis, you have to understand the training of a medical doctor. Our training is premised upon trust. A trust that the patient who sits in front of you is telling you the truth of what is ailing them. And the patient also trusts that whatever they're telling you, you're going to keep it confidential, you're going to make the right diagnosis, and the drug you'll give them will not kill them. So we trade in trust more than anything, and truthfulness and honesty. But we now find ourselves in a spot where the people we are engaging in are highly deficient in trust, highly deficient in honesty, and highly deficient in truthfulness. And why do I say so? Because doctors in 2013 sat down with government and a CBA was signed and put in place. The same government disowned that CBA in 2013 and forced us to sign a new one after a protracted 100-day strike.
Was that 2017 or 13?
2013 was the first CBA.
13 was the first one, okay.
2017 was the second CBA that they forced us, because we insisted that no, we have a CBA that you must implement. They said no, whoever signed it was a stranger, sign another one. Then they forced us to sign a new document after disowning the first one. It is the government lawyers who carried this document to SRC, and they gave no objection that everything there is acceptable, sustainable. It is the same lawyers who then took this document to court and deposited it, and it was adopted as a court order, not the union. Then now we meet 7 years down the line, the same government comes to you telling you that no, we are disowning the second CBA again now. That then it was signed under pressure, it was near election, it was another government. So the doctors then like, wow, we thought that we are honorable and honest people. Why are people changing their minds and playing ping pong games with us? And that is what our members are saying, that no.
This time around.
You fooled me once, shame on me. Fooled me twice. No, fooled me once, shame on you. Fooled me twice, shame on me. We are not ready to be fooled a second time.
Okay, I'll come to you. Dr. Matende Charu, this is familiar ground for you. You have defended the doctors before. Why is it that we can't break this stalemate right now? Is it the other side that is not ceding ground? What is going on?
Yeah, thank you very much, Ken. And thank you for even starting us off with a clip of me, speaking about the situation as it was at that time.
That was 2013?
Yeah, that was about 11 years ago.
Yes, 2013.
Yeah, yes. 2013. And what we were fighting for at that point was an opportunity to be able to sit down and discuss, which was a bit difficult at that point, because as leaders of a young union, which we had just established, we were finding it very difficult to sit with government so that we can discuss. And we were just in the thick of things trying to establish a collective bargaining environment where we can be able to discuss, with the respect across board and be able to work together towards achieving our common objectives. But 11 years down the line, we are now in a situation that really puzzles me because at this point, we have been able to really mature in being able to have these discussions around our labor relations.
As the union?
Especially on, now I'm in government, I'm the
yes.
Deputy Director General for Health.
Yes.
And I have also contributed a lot to the current situation where we are very receptive, as opposed to 2013 when we would literally be frog-marched out of the Ministry of Health. Right now, our doors are open. We have very frequent meetings with the trade union leaders so that we can be able to advance the discussions around collective bargaining. Now, the current stalemate is what is really worrying me because now we are just about to hit a month, which I really hope we won't. We are, I think, at about day 28 of a doctor's strike in the country. Now, this is a catastrophe because generally we are not supposed to have a doctor's strike at all. And even if it happens, then we should be able to resolve it very fast. However, now that I am sitting on the government side, I've found it very difficult to understand why we are not able to engage. My senior, Dr. Nyikal here, has even accused the government of walking out of collective bargaining
and not
process.
going to the table sometimes. He didn't say that.
Yeah, but I would like that to be substantiated because now I am deep into the negotiations as one of the key participants from the executive side. And I have not seen a situation where we
You've not
have
walked
been,
out of a meeting?
No.
Have they walked out of any meeting?
And just,
Let me tell you.
Yeah, no, just answer one question, then I go back
They
to
have
you.
walked out
They've
of
walked
meetings
out
on
of-
live camera.
Okay, they walked out of the meeting.
I was in that meeting that we purportedly walked out,
Yeah.
and I can tell you that we didn't walk out. And that is why I can tell you that I think there is a problem. We should not really be doing this. As we continue trading barbs and trying to, give perceptions and whatnot and, argue, there are people who are dying out there. And me, that's what worries me a lot. There are people who are losing their mothers, there are people who are becoming orphans and so on. We are all very reasonable people, yeah? We all work together very closely. The environment we have created is enabling for us to be able to discuss even as we give services to the people. Why can't we just be able to take advantage of that environment
Open doors.
so that we can now be able to work around the issues even as people continue getting services?
Let me ask you,
Yeah.
did you care about what you care about in 2013?
Absolutely. What we wanted to do is to be able to address the issues that were facing the doctors. Now, let me tell you something, Ken. Yeah? In 2013, we were struggling to get a collective bargaining arrangement. I managed to sign, I was actually the Secretary General of the KMPDU by then.
Yes.
I signed a collective bargaining arrangement with the government, collective bargaining agreement, without going on strike. And nobody has ever asked me, how did you manage to do it?
Okay.
The interns who are the bone of contention in this strike, if you look at that collective bargaining agreement, if it would have been implemented to the letter, would be earning over $500,000.
Right now.
Yeah?
But it wasn't. Are you admitting it wasn't implemented?
No,
to the
I'm
letter
just
then?
telling you
Yes.
that collective bargaining arrangements are about seduction.
Okay.
And nobody has ever asked me, how did you
How did
manage to
it?
do this?
We will ask you that question. We will ask you
No,
that
I
question.
will not tell you because it
Why
cannot
would-
be said on, in arrangement like this one. We have to sit and then we discuss so that I can be able to give
No, but
that
you can
kind of
tell them as an
information.
advice that this is what we did then.
It is
to forestall
about
this strike.
seduction.
Okay.
Collective bargaining agreements are not a one-sided document. Collective bargaining agreements are about two sides coming together so that we can be able to see what is one side benefiting and what is the other side
The
benefiting.
gentleman will complain that I've given you a lot of time. I know they're itching to speak, but let me come to you. Why are you accusing the government of walking away? Yet clearly, they have hosted meetings. You have attended the meetings. You can't simply agree on the matters. Is this one of the issues Or is something that is, how do we call it, a sideshow?
We are not just accusing the government of walking out of the meetings. We are accusing the government of going on strike and the union just joining them. And I'll qualify that statement. When we had the court order as a CBA in 2017, the government did not implement the CBA. In 2020, we sued the government for non-implementation of the very CBA that we seduced them and they had signed in live camera. And the judge ordered them to implement and report in 60 days. They contempted that order too. 2 orders contempted. When we chose to go on strike in December 2022, the new CS, Madam Susan, and the Council of Governors and Governors met us and seduced us not to go on strike. That is a new government, we give them time. And on the 6th of January last year, we signed a matrix of them telling us when they are going to implement the issues and timelines. Okay. The longest one was going to be 3 months. It was about the money. By law, mediation should take 90 days. This one took almost the whole of last year. In fact, the part that took the longest was what we were analyzing, how much each doctor was owed. And by the end of October, we already reached some level of agreement on how much we were owed. And we're now waiting for the report. Because of that goodwill, we went to Safari Park for 2 days. We went to Kapkatet and signed the Kericho Declaration, where the government, again, after seduction on both sides, listed our issues and promised that they're going to sort them under KHRAC, the Kenya Human Resource Advisory Council, under Professor Wafula. Signed, they're going to sort our issues. And we also signed that we want to go on strike for 2 years as the Kericho Declaration, signed on live camera in the presence of the head of public service. We came to Nairobi. And again, we met government in January. First of all, the report for the mediation was nowhere to be seen. Second of all, we were promised that by February, the interns were going to be posted.
2024.
Yes, we met again mid of February again this year. We were told by end month, these guys are going to start their internship in March. We told the young doctors to go book accommodations because they're posted, they all can't, they ballot all over the place. Yes. So they went, secured the houses, paid deposits, they took clothes from their friends that they're starting work on March. Only for March to arrive, and everything that we had been promised was trashed. Ask me. In all this, there's still an internship policy made by the same ministry that interns are posted after 1 month. There's still the Cap 253 of the Scheme PDC Act that describes who an intern is. There's a CBA who also speaks of the same, the posting duration, what they earn and what they do. All these are legal documents available.
Yes.
It's the government who has gone against every tenet of the law and promise between us and the government who is on strike.
Who's honest and who's not? It's the government.
Oh, and they're walking out.
Yes.
Let me tell you, we had the first meeting of the whole of nation under Most Honorable Head of Public Service. We had a good meeting. We had a subcommittee of 13 people. We were government were 9. We were only 4. But we trusted them and we sat down.
By
9 people. We were only 4 in the committee. Yeah. They highlighted the issues and said the immediate, intermediate, and long term. We still had other meetings on the sides with the cabinet secretary and of public service, and we agreed on very many things. The only problem that occurred is that the head of public service traveled out of the country for 1 week. And whoever was put to help salvage the situation, when he came, I think he didn't understand where we had come from.
Who is this?
The deputy chief of staff, Honorable Nanok. He didn't know where we had come from. We had spent 8 hours on the first meeting. So for him, when he came, he started from where we had started on day 1.
Afresh.
There's a court order.
Why you
and we asked that, look here, the court order said all governors to sit here. There's only 1 governor in the first meeting. In today's meeting, that day, there's only 4 governors.
Okay.
Themselves, they have not respected that court order. And as a union, we also challenged them that the clinical officers union were once ordered to go back to work for negotiation. They went back to work up to date. Even their current strike is about government coming to the table. That's why they're on strike. So you think I can see my brother going through the same fate that we have suffered, and we just walk into that gallery singing Hosanna, Hosanna. We have to push back also. It's up to them to show us the goodwill. Goodwill is earned through previous commitments fulfilled.
On that. Dr. Nyikal, stalemate.
CBA is, what did you call it?
Seductive.
Seduction. If it is a seduction, it's the process. When seduction has been completed and an agreement reached, the marriage must be consummated. If there's a seduction where you reach and the marriage is not consummated, what happens?
Null and void.
Null and void, and people split. So, if my friend says he got the collective bargaining agreement and it was not implemented, that is where the problem. You know, this is medicine. This is not politics. Yes. And in medicine, there has to be reality. And it is like I'm telling you, I'll give you some tablet to bring down your temperature, and I come with a placebo and say I'll give you this, the temperature will not come down. So the collective bargaining agreements really must be respected. I saw on TV the minister saying that that document was signed while I was not there. There's a big principle of governance that is being disrespected there. Governments exist in perpetuity. What a government did, the last government did, the new government owns it. If it were not so, why would we be paying loans that were taken? To me, the bargaining agreements, a legal one like this one that went to court, is a legal document that binds the government, just like a loan that we borrowed from whichever binds us. Are we not saying we cannot pay those loans because we were not in that government? So the bargaining, collective bargaining agreement should actually be implemented. If a circumstance arises that makes it difficult to implement them, let's treat them exactly the same way we treat those loans that we respect. Sit down and discuss with the parties that were involved and now restructure. The loans, they restructure. If we think that the bargaining agreement, the collective bargaining agreements is difficult to implement, we must sit down with the parties and say, this is what we want to do, suggest on this. You just don't disown it. That is bad governance.
But don't you think, Daktari, it's because the doctors are expected to make a move before the government? Is it not the exact place where there's a problem? The government expects the doctors to make a move before they can do something, and the doctors don't trust that if we make this move, the government will fulfill their side of the bargain.
The doctors have made a move. They've gone on strike.
No, to go back to work.
So, to go back to work.
Yes, don't you think that's what the government wants?
If they said, look, you can't tell somebody to relinquish the very weapon that they're using for discussion. You tell them, go and destroy this and throw it away. Then we come and discuss. In the world, there's no negotiation that is done like that. You talk first, and if you see there's good progress and you believe that you can trust what is going on, for what people are saying, people can't be negotiating with you and then going to funerals and saying, this document was signed when I was not there. Tomorrow morning, when you go to the negotiation table, what is your mind supposed to think? This is the person I was talking. He's in a funeral. He's saying, this document was not there. They are out there saying, how can interns be earning 206? These are things that will not happen. But you are sitting there and negotiating. Let me tell you, me, I see a bigger problem of governance. What you are seeing in the health sector is everywhere. The only thing is health sector is sensitive, and therefore the matters are coming out. The health workers are organized, and they're saying this. So the problem of governance is that I don't see seriousness in governance.
Okay.
People make statements, they don't, which you can't make that kind of statement while there's a discussion going on. You can't.
You can't speak about it publicly. in public
And
forum.
even if you do,
Yeah.
the best you can say is we're discussing about it. We hope our doctors will do. But you can't make statements that are indicating that there are things that you will not discuss, you will not accept, you do not own. Now, if you don't even think you want to talk about the collective bargaining agreement, why are you sitting down? So what I'm seeing, there is a problem of governance that we are seeing. Now, he has just told us something, that they seem to have been doing hell with the head of service. And the head of service goes away, and the deputy comes in, who is a former governor, and then things break. Me, administratively, the question I would ask, first and foremost, was the person who came in to negotiate when the head of service went, was he briefed? Mm-hmm. If he was briefed, bad governance. If he was not briefed, bad governance. And it is these small things that are making people, you know, I feel very bad. When you talk these things, a lot of people think they're paper. That collective, they think it's paper. They don't know that behind these discussions, people are dying. Saturday, a child who had gone to Kisumu twice
for treatment,
nearly died in my house. They come to me. They know I'm no longer practicing, but you are a doctor. What can you do for us? I just said, I called the hospital, give them my vehicle. The child died on arrival. As I'm talking now, there's a child who has got a brain tumor, who again the following day was having convulsions. Again, I was called. They call us. And that child, okay, it can be controlled. But so long as you don't do, and there's nothing can be done, he's supposed to come to Kenyatta for operations. What we are saying, even if they come to Kenyatta, we'll get the
surgeon is sitting on the table here
So
tonight.
now, we have to be very serious about this. I have a problem with the governance issues.
Okay. Are the politicians the setback in the progress of these discussions? Listening to Dr. James Nikal and Dr. Miskela, don't you put this blame now on politicians? Because you're a technocrat, you're not a politician. But now, are they the people who are causing this setback?
You know, Ken, I think when you just listen to what is happening here now, then you see where the crux of the matter is. We have gotten into, you know, I was trying to even follow the issues as they come. Mm-hmm. But so many issues have come out on this table, I got lost somewhere in between. Now, we are in a very big discussion of many things, including even now governance, payment of loans, and so on. In the meantime, what is happening? Dr. Nikal has talked about patients who came to his home. Those are just two.
Yes.
There are hundreds and thousands of Kenyans who are suffering as we continue trading barbs and arguing and talking and discussing. They are suffering out there. We are using them as ransom, as bait, you know, to negotiate. You know, it is something that is catastrophic. I think we really have to step back and just listen to ourselves and see what is happening. Because these issues that have come out on this table are so many. They are very pertinent and important. But we cannot discuss about them while the doctors are on the streets. We need to discuss them in an environment where our patients are getting treatment while we sort them out.
He just told us they've tried to discuss this before the strike, before they went to the street, and nothing happened. They were promised. They even went to court. Nothing happened. How do you morally now ask them to call off the strike and then talk to them? Yet there was that perfect opportunity before the strike.
The right thing is to sit here and discuss about the efforts that have been made to try and address the issues in the CBA as patients are dying. Is that the right thing to do? Is that the moral thing to do? I think we are missing the point here. We need to become human. We need to think about those people who are being affected so that we can be able to... Now, look at the bone of contention that we are looking at today. There is a very clear reason why the interns were not posted as the plan was to post them in January. Mm-hmm. Very logical, and it is there. There is even evidence. We have been sitting with the union leaders every single day. We sit with them, we talk to them about it, we even show them. We tell them, this is why we are not able to post.
What is it,
the
financial
interns.
issues? What was it?
Yeah.
What do you tell them? What was the reason why the interns couldn't join in January or be posted in January?
Okay, so let's maybe just touch on that as well. Now, this is what happened. In July last year, we received the allocation. The financial year starts in July, so we received an allocation to post interns. Now, remember, interns, when you post them, there are two things that are of importance here. First of all, they get an opportunity to go and translate the knowledge they have received in college into skills and practice, you know? So under supervision. So that is one thing. They have to go and undergo that supervised experiential work so that they can be able to gain the skills and attitudes which can enable them to be licensed on time. Because if they stay out for very long, the knowledge that they gained can also decay. Number two, we need money so that they can be paid because they are also offering services. So we had a situation where we were allocated 3.7 billion to be able to post these interns and pay them.
Okay.
Now, at July last year, the number of interns whom we needed to send out needed over 5 billion, about 5.2 billion. So what did we do? We looked for some extra money. We added to the 3.7 billion. We posted the first batch. Knowing that in government, the way it works is that we will go to supplementary and request for, when the supplementary budget is done, we will request for resources for the second batch, which we did. We requested for 4.9 billion to send the second batch in January, February. But when we now got to January, Treasury told us that the circumstances in the country are such that we cannot afford to give you 4.9 billion. And they gave us a lot of reasons and everything and whatnot.
The compromise
We
figure?
appealed to say, now, you know, we are getting into a bit of a difficult situation here. We had even committed to send this second batch of 3,759 interns to go out there to do their internship. They wrote back and told us, we do not have money. We told you that, you know, whatever we gave you, in fact, you overspent. So this time round, you just look for other ways of either deploying them so that they work without being paid, or you wait until July.
Okay. Of
When we will
2024
give you, when we will give you another allocation, then you work within that allocation to be able to post the interns. Now, these are things that we were trying to work on. So at some point we said, now waiting up to July, these interns have been out for over 8 months. So what is going to happen? And we said, okay, if there are some interns as per the advice of Treasury who are able to take care of their internship, then they can go and start achieving time value as they pursue licensure instead of waiting until July. But then what about those who do not have resources?
What happens?
And now we explored a different avenue to try and see, can we raise some resources that can enable them to go for that placement as they look for the licensure, they can be able to fend for their needs. So there is a whole issue that we underwent, which needs us to be discussing and to understand the circumstances while patients are getting
treated.
Services.
Okay.
You know?
Okay.
And we are talking about this having been, being accommodated in a CBA, which is a legal document. Yeah. Number one, CBAs are renegotiated after 4 years. Why are they renegotiated?
Upwards or downwards?
Why are they renegotiated?
Are they supposed legally, do you negotiate them upwards or downwards?
Either upwards or downwards.
Okay.
It depends on the circumstances.
Okay.
Actually, that is why there is provision for renegotiation. Because in the last 4 years, when you negotiated the first CBA, circumstances could have changed for the better. They could have changed for the worse. So that is the time you sit down and take into account all those issues for you to be able to now come up with a new arrangement. Okay? Now, this is contained in the CBA, yes. But then, are we able to do it? No. So what do? we need to be able to agree on a way forward. But do we agree on this way forward when patients are dying? I don't think that is what we need to do.
So the imperative for you as the government, before I go to them, is we cannot do this when the patients are dying. That's an imperative.
Not as government. Me, I am just even talking as a human being, you know? Because as we speak here on this table, I am sure there's someone who's dying.
This language is so clear, Daktari. The language you're speaking is so
and
clear.
it is not like we are not doing anything. We are really trying.
You're not understanding the language of the government. Where is it? What are they not telling us on the round table tonight that they are telling you?
First of all, I really appreciate my brother and senior colleague, Sultan is the one who mentored me to the union. When he was the SG, I was his right-hand man. And he would hold my hand and teach me these ways. So whatever I'm doing and whatever I'm going to say today is what I learned from Sultan Daktari. One, on the first interview that the CS of Health did, she was on this table. There are the clips. She said how interns are paid a lot. That's the first comment she did, and she suffered the wrath of the young doctors by that comment alone. It was before this December, January, the year issues. So clearly she tells you the kind of mindset that people are coming with right from day one into that office. Secondly, is that as doctors, and I want this to be very clear to Kenyans, doctors are not stubborn people. Doctors are those children of yours you saw work hard, be disciplined, and pass KCPE and go to high school, and you celebrated them. Doctors are those children who are so disciplined in high school, worked hard, most of them were captains, never went on strike, passed exams, you carry them on TV and ask them, what do you want to be? A neurosurgeon. These kids know nothing except discipline and hard work and endurance. So much so that after 7 grueling years of medical training, where the only thing they do 8 to 5 every day is study. They don't have those long breaks we hear about. They're not taught about entrepreneurship. They only learn about the human body, how to alleviate human suffering. When they finally become interns, they spend 48 hours, 72 hours doing nothing but alleviating human suffering. These patients, let me tell you today, Sultani in his office in Ministry of Health, these patients today, Madam Waziri in her office cannot purport to feel this patient's pain more than me. Why? Because I'm the one who has seen this woman when she got pregnant on week 4 when she came to the clinic, and I promised her that I would deliver her. It's me who worry about her. It is me who knows the child who has a convulsion disorder, who I see every 3 months. I'm worried about that patient as I sit here. It is me who knows about this grandmother with diabetes, who her sugars are not properly controlled, and I have to see her every month, and her kidneys are going to shut down. And when the strike ends, it's me who has to look for them to sort out their failed kidneys and either dialyze them or enjoy the pain of asking about her, and then I'm being told that she died. I feel that pain more than people sitting in their air-conditioned offices. So nobody can come here today and tell doctors that they don't care. We care, and that's why we have been begging. That's why we waited for 7 years for the CBA. That's why when we were given a promise 1 year ago, we sat for mediation for 13 months, not the 90 days we have been told. That is why when you read the ILO Convention on the right to strike and the restrictions on the essential workers, it clearly says, and I can share with you the booklet, that for the workers who are denied the right to strike because of human suffering and the essential nature of their service, whenever they have a dispute, you must ensure that you sort it rapidly, and you must have an impartial arbiter to do it. But more importantly, as they finish, they say that any agreement agreed out of that process must be implemented swiftly and completely to ensure they don't go back to threatening strikes. That's ILO now, which we ratify as a country. Let me ask you, as we sit here today, what have the doctors not done? Even today, as I speak to you, we put 19 issues across the table. We never received any counter offer.
Out of the 19?
We were told, give us your bare minimum. No counter offer, give us your bare minimum. We wrote another return to work formula, gave a counter offer of 10 issues. They bounced it back again, give us a bare minimum again. We went down to 5 issues. We are still being told we won't talk to you until you call off the strike. So we have been negotiating with ourselves. And all we are saying that please, 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 Kenyans did not sign up for this. Patients don't have to suffer because somebody somewhere feels like they don't like how a CBA has been worded. We can even say that, let's even put the issue of the internship, that we can reopen it in the next CBA cycle. Because remember that this CBA was run from 2017 to 2021. But there are clauses, because the law knows that the employer can be very naughty, that if you don't sign a new one, this CBA continues to run. Mm-hmm. So when the CBA elapsed over 1 year ago, we gave a proposal for a new CBA and we wrote a letter telling that, please, let's have a discussion. If they knew that this old one was not going to be successful, they would have brought a new discussion then. But more important, that CBAs are like building a story building. When you build to the first floor, next time when you have to go to second floor, you don't build down first floor to build second floor. You build upon something. Because the salary they're proposing even to the interns is salary that was paid to doctors 15, 16 years ago. You cannot go back. But bigger than even the issues of the interns, there are issues that this government has refused to listen to. For example, do you know that as I speak to you right now, the healthcare workers in some counties are not being paid their January salaries? Kirinyaga have not paid their salaries. I can show you the letter. Yet they bought chairs for 700,000. Do you know that 11 counties don't have a medical cover for their doctors? The late Dr. Steve Moguso died from COVID, working in a COVID center in Machakos. When he fell ill, he couldn't be treated in the same place where he worked. Where did he go to? To Kayole, to his sister's place, and he died. Without a medical cover, he had not been paid for 5 months. The day he died, Mutai Kabwe was scrambling to look for money to pay him posthumously. Do you know that this year alone I've buried 4 young doctors to suicide from frustrations from the workplace? Do you know right now, as we speak at Agui, the MTRH and KNH hospital run on the backbone of doctors who are doing master's training. These doctors, their fees has never been paid from 2018. They study, they work for free. And when exams comes, they are locked out of exam due to non-fee payment. Then the country tells them that you have not done your exams, you have repeated the year, we stop your salary. I have not seen my salary for 17 months. These are the same people who work without a salary in self-sponsored. One of them fell ill when working in Kenyatta. She couldn't even receive the care in the clinic she was being treated in. In MTRH during COVID, the CEO told them that we won't give you vaccines because you are students, we are not our employees. They vaccinated even drivers before vaccinating the students. There are issues that you cannot reduce to just the internship. These are critical issues that unless we sit down and ask ourselves.
What is the bare minimum that you're willing to take before I go to Daktari?
The bare minimum we are willing to take is government sitting down with us.
Which they have
and
done.
First, they worked out.
Well, no,
and I have a letter I can show you of the government saying that they will not engage us any longer until we call off the strike. And the bare minimum we're willing to take is just sitting down. Government acknowledging that we agree there's a problem and we are willing to solve it. And this is the way we will solve it. In the meantime, we promise you that this, because they say that we are so essential and people are suffering. Patients have been suffering for the last 12 months when interns have been out. They account for 30% of the workforce. Now that we have seen our value, we appreciate that. Post the interns and tell them that we'll pay them from July when the budget comes. One. Two, tell the doctors who don't have school fees and are working for free that we acknowledge the work you do. The universities belong to government. We'll write to them to allow you guys to do exams and we'll give you a stipend so that you don't have to work for free.
That's three.
We will tell the contract doctors who are earning a third of salaries, because now employers, the counties, have come with a very, very illegal thing and there are court orders to that you cannot have two people working in the same department. One earns 200,000, another one earns 70,000. Same rota, same job. Let the government say that as public service, we will not break the labor laws. When you employ somebody, employ them on equal terms. Finally, we are asking that please, on the issue of the money that is owed to doctors, you know you owe the money. Treasury has said they have the money. The court have pronounced themselves on the money. Let them go.
The 2.5B.
No, we are all 3.5B.
3.5.
Then there's a small matter that can be solved just by egos coming down.
Okay.
Nairobi County, NMS hired 113 doctors in Nairobi County. When their contracts ended, public service, which had hired them, when the new county government came, told what was advised that employees of NMS should be taken in on PNP. But you know what Nairobi County did? They instead chose to re-advertise. He's a doctor. He'll tell you that doctors become better with experience. You rather retain the ones who have relationship with the system than hire more. But now we came to know why they did that. When the doctors reapplied, the county gave slots to their cronies. Now you apply, you put your number. They're now calling them. Do you have 500,000 shillings? Women, our lady doctors are being asked for sexual favors. You don't tell us. We have the messages.
Those are not factual. We can't.
These are factual messages I can show you. And that is why we are on strike. And that's why doctors are angry.
Yeah.
Because we believe that doctors' rights are equal to patients' rights. When we say employ doctors, it's because we don't want that woman to come queue the whole day to see a doctor.
Okay. Are this too much to ask? That's what I'll ask you. Is this too much to ask? The 4 irreducible minimums before I go to Dr.
You know, the first one is the easiest. Let's sit down.
And talk. Yes.
Then the second one is, if the money is not there now, post us and pay us later.
Yes.
That is not too difficult.
Yeah.
This thing of contract of UHC, you know, even if this UHC, using the word universal health cover, I know they used it during COVID, and then they employed the doctors on contract and made them believe that they'll be absorbed, reasonably so. First question, how, even in a crisis, how can you employ somebody, pay them half or less than the other person? They are doing exactly the same job.
What of experience? If some are more...
All medical officers.
No, if these were all medical officers, there's no question of experience here. Then you say, okay, you use the word UHC, Universal Health Cover. Now, the whole country has been made to believe that our next big thing in healthcare is universal health cover. So you tell us we are going to expand universal health cover. But at the same time, the doctors that you employed using the same program, you are saying you are going home. What do we believe? Governance is the issue. Now let me come back to budget. I sit in budget. You know, I've even negotiated strikes. I mean, the biggest pay rise was negotiated in 2000 when I was Director of Medical Services. When these allowances that are being removed were introduced. Nobody has even asked or gone into the records and say why those allowances that were there. They were just being removed. Now, agree. When you come to the budget, we know that you say this is the money we need to employ interns and so on. You know that we have been with you there. And that one we never argue about. You also, as you say, actually put the right figures. Now, things then turned difficult, the money was not coming. Now, what was expected is go back and call the doctors and say, this is not going to happen when we want, let's see how we are going to do it. But what then happens, the first thing you come on air and say, these people are too expensive. Is it they're being expensive, the issue, or that the money that was promised in the budget did not come? The next issue you come with and say, these guys are students. Dr. Machendichero, when you came to the budget and you were asking us to give the money for the interns, were you talking of the salary they have now or the 70 that is now being brought on board? And then what is the reason? Yesterday, the chair of the CRC, Madam Mengich, said, this is not a remuneration, it's not a salary, it is a stipend. When you say it's not a salary, it's a stipend, you know what we are saying, Dr. And we can't do this to our doctors. We are saying that interns are actually people, and you seem to insinuate it, who are being helped to learn and get experience before their registration. Now, I really want this to be removed from the thinking of those people in the ministry. And you are the one who can do it. You have been an intern. You know what you are doing. you know the work you are doing. Interns work. These are doctors who have graduated, they have taken the Socrates oath, they have a provisional license. They work. There's nobody who does not work under supervision at any level. At any level. People, we all work under supervision. Now, that work that you are working under supervision cannot be the reason to say you are not working. An intern will admit a patient, will examine the patient, will start treatment. If everything is going on fine, they'll discharge. Is that not so? And they have done the work. Now, it is only like everybody else, even if you talk of medical officers, even if you talk of surgeons, there's a time you get to say, what I've got here, I need somebody senior to me to look at this, in all along. But this argument that is being, and you know, Dr. It is being put to the lay public, and it is taking root. Interns work. The term, we are missing out the term, and you know it. These people are called medical officer interns. Where are we throwing away the word medical officer interns and just remaining with the word interns? We are playing politics with the position of interns. Okay. So they work, and therefore they should be paid.
They need to be remunerated.
Remember, interns do not only work in government hospitals. Interns also work in private hospitals, and the private hospitals pay them. Would they pay them, my colleague, if they were not working? How did interns get to work in other places?
Yeah.
I did that in about 2000, when I was actually in the medical board, because that time interns were only working in 8 hospitals, and you know it, the provincial hospitals then. We asked ourselves, things are changing, we'll have more doctors. Let's say a hospital that has to capacity so that the interns will work and somebody will sign them off.
Okay.
And we get that and we work. Interns are working in Tenwek. Interns are working in Forces Memorial. Interns are working in Kijabe. Okay. Interns are working in Aga Khan. So why things are not on, my friend, it's this. I agree with my friend, Dr. Matendichero. We got the budget. They didn't get the money. So they're looking for more money. That is the thing we should discuss. Yeah, okay. Are we going to get more money? If we can't get more money, we can take these people, we'll pay them later. But don't at that moment bring the argument that you are earning too much and also you are not really a doctor. Now when you bring that, they'll not work with you.
So
that is what the problem is.
We have a bit of a problem, because we seem to be making reference to other discussions that are off this table, and then we are now.
No. Let me bring it. You are a public health specialist.
Yeah, but we are not.
You are a public health specialist.
Yeah, but we are not.
And you know that what you do.
And you see now the problem, Ken, is that if we are not even going to achieve anything, because at the end of the day, we are not having a logical discussion. We are talking about one thing, then we jump to another, then we jump to something that probably was said by somebody else, and we are mixing up everything. And at the end of the day, we are not getting the correct picture.
Bring us back.
No. We are back. Let me tell you this.
Dr. Miskela.
No. Let me tell you. No. I'm not finished.
Because you see
I keep quiet when people are talking.
We've given you
now listen.
Okay, we'll give you a minute.
A minute, please. When we have agreed, what is it that can be done?
Yes.
He said, we have said those. Those, if are done, will get us to where we want. But my colleagues here and you, we cannot leave the major issues that brought us to this point.
Okay.
So those are the ones I'm bringing. Now, let me even bring more. If you say that the issue is money,
yes.
Last week, the same government forced a bill through parliament that is going to employ CASs.
one CAS.
You see now, those are the issues.
So if you're saying
Why-
there's
why-
no money,
So,
You are going and he wants us to restrict ourselves to doctor. Let's allow him to.
okay.
How are we going to employ CASs? How are we going to handle that?
Daktari,
Because you are saying we have no money.
As we continue talking about CASs,
Yes.
patients are dying out there.
bring us back
You know?
to this discussion.
And these are
Yeah,
things that
bring
we
us
can
back.
be able to talk about.
Yes.
Now,
Yes.
my brother Miskela here talked about 19 issues. Actually, there were 22 issues that came in the strike notice. 22. Yeah? Number one was the issue of interns. Now, I was struggling to try and explain that there was no money to post the interns. Yeah? But because there was pressure, actually, in fact, the strike started. And, as somebody who, as a responsible government, you want to say, let us see how we can be able to enable these doctors to be able to go and practice, Now, you don't have enough resources. This stipend that you say Lynn Mengej was talking about, this stipend is not mandatory. You know that? It is not mandatory. It is just an arrangement, a stopgap measure that you can be able to utilize to go and pursue your internship a bit earlier, So that is something that, we are trying to see how do we manage to go about this issue. And all the interns actually have received their letter offers, their letters of offer, and they are at liberty to accept the offer or to not accept it. Now, I just wanted to give you a little bit of an insight into the issues because they are coming and mixing up, everything is coming together. There was an issue of conversion of UHC workers. Now, the contract for UHC ended last year. It was renewed for 1 year. And the reason why it was renewed for 1 year, it is so that, at least arrangements can be made to see if we can be able to absorb these workers into permanent and pensionable. Remember, when they were signing up for the contract, they could see the terms on the contract, okay? Now, at the end of they accepted and signed. So now, getting midway, we now say that they are being paid discriminatory rates, and that's why it was said that we cannot renew this contract for 3 years so that now they continue getting lower salaries. We need to just extend it by 1 year so that they get absorbed. Now, if they are not absorbed by the 1 year, there's the option of terminating the contract. But you see, these are things that are being discussed. We can even come up with another option of saying, let us put them on another contract, but now at rates which are at par. But these are things that we need to discuss when people are working. Now, there are other issues like comprehensive medical insurance cover. From where I sit, there is a comprehensive medical insurance cover for all the health workers in national government. There are some counties which have made arrangements, and I think from the discussions we've had, although I'm not competent enough to do this, but from the discussions we've had, about 36 counties have made arrangements for their workers to be covered by comprehensive insurance. 11 have not done it, but then of course we are trying to see how we can be able to encourage them to do that.
Right. Okay.
But you see now there's a strike in the whole country because of those 11 counties. There's the issue of postgraduate students. That one has been addressed because our Principal Secretary for Medical Services has even requested the universities to be able to provide the details so that the money can be paid. So you see, these issues are being addressed.
Okay.
But you see, what I would have wanted to say is, even as we continue addressing them, some of them have already been addressed. Some of them have not been addressed. Some of them might take a long time.
But they will be addressed.
They will be addressed.
If you limit yourself to the 4.
Why should we?
Yes.
Why should we now stay until we address each and every one of them
Before they
while
go back?
patients are dying?
If you limit yourself to the 4, forget about all the 22. What is difficult with limiting yourself to the 4 only, and they're saying this bare minimum, we can sit and talk, which you've said you're willing to talk.
Now,
that is out of the way.
Look at
So you
the
have
basic pay.
Yes.
Basic pay, we know that that one has already been done by the national government. And I can assure you, there are discussions, we are intervening. We are having discussions, we cannot talk about it on such a table, but we are having discussions to see how this one can be addressed. Dr. Nyikal, you are a senior
The basic pay
official.
for the medical
Yes.
officer interns.
Yes.
That I'll agree with. If it's being
Not
addressed,
for medical officer interns.
the money owed.
You know what happened is in 2017, the doctors, we negotiated a CBA which gave doctors a higher basic pay than all the other civil servants, which usually is a bit difficult to implement because the policies are such that in the civil service, whether you are a librarian, whether you are an architect, whether you are a lawyer, for as long as you are in the same job group, and Dr. Nyikal, you know this, you will get the same basic
No, I'll
pay.
tell you how the difference came.
What question is,
What-
how did it,
what
question is,
changes-
how did they agree to that and sign it?
It is something that the doctors are
And they
not
implemented
very...
it in MOH, they implemented what
And I'll explain you how it came about.
The doctors are not very happy to hear this, but then, you know, there was a 100-day strike. And, you
So
know,
it
it was,
pushed you to do this.
2017.
Yes,
It was
during the election.
2017. Elections were coming. And now, you know, things had to move. You know?
Okay. So the government would win to them.
This addition,
Yes.
the national government has been able to pay.
Okay.
You know, even if it was a bit higher than
They paid it.
the normal.
Yes,
It has even overpaid.
Okay.
Yeah, it has even overpaid.
Give them back 80,000.
Yeah, we need a refund.
80,000.
Now
80,000.
the counties have not been able to pay.
Okay.
For good reason, and I can assure you, having been on the table where this issue is being discussed, there is a very clear way forward on how this is going to be addressed.
Okay.
So even as it is being resolved, we don't really need to keep those patients on the street. Now, I want to give you also another example of a patient who was even on social media the other day, who had actually,
Mastectomy.
bilateral. Both breasts have been removed. A cancer patient. You know, when Ms. Keller was talking about his patients, you know, he cannot abandon them and so on. This is a patient who went to hospital and couldn't get treatment. Do you know that we have looked for that patient and she has started receiving her treatment? From the air-conditioned office, we have gone and looked for her because she was not able to get treatment.
What
She
about
has
the
been
thousands?
abandoned.
What about the thousands?
She has been abandoned.
Who don't have
on social
cameras?
media.
Yes,
She
who
has
can
been-
access
she has
TikTok?
been abandoned by
What
the
about the
doctors.
thousands who can access TikTok?
She has now started receiving treatment. Yeah?
Through other doctors.
Yeah,
Willing
we
to.
have had to even go and get doctors from outside of the country to come and see some of these patients. Now, another thing is our own doctors. You know, there are quite a number who feel that they can be able to provide these services, even as the strike is going on. Them, they feel that no, let us provide services. I'm wondering what Dr. Nyikal did with those patients that came to his house.
He
even
just
if
said
it
he
is not-
sent them
I
with a
sent
car.
one to the hospital and
to
he
the
died
hospital.
On the way,
on
yes.
They died.
Yeah.
So there are some doctors who really feel that they want to do something. But unfortunately, they cannot because the environment has been so hostile for them, they cannot go to hospital to provide these services. So what I would say, let us start by allowing those who feel that they would like to provide the services, let them just go and provide the services.
Can I comment on that?
Even as we
Yeah,
we continue discussing about how we can be able to suspend the strike so that all the doctors can go
Everything
and
you say
provide
has
the
a
services.
footnote, and I've realized everything you say at the end of it, you have to patience. You have to
Yeah, they are
patience.
dying,
Everything
surely.
you say,
They
your
are
comment,
dying.
Yeah,
your comment.
I'm really amazed today that for once, Dr. Matejeti is asking us to allow those who want to work to go work. Justice Linet Ndolo on July 2021 gave a court order that when essential workers like doctors go on strike, let there be a minimum service agreement. That, because for us as KMPD, we know that our strike is not successful based on how many people die or suffer. When the order came, we wrote a letter to Minister of Health to come, we sit down and have a discussion on the minimum service to alleviate patient suffering and death without compromising the strike. The government ignored that court order. The latest court order by Justice Byron is clear that even as you are engaging in whole of nation, let there be a mediation process that comes with a minimum service on numbers and cadres who will work. Numbers good enough to prevent patient death and suffering, but numbers few enough not to compromise the success of the strike. And he sits in that mediation committee. Do you know the first meeting we had, government had no proposal. On the second meeting, government comes and tells you that they want 75% of you to work. In fact, they even asked for a dermatologist in every level for hospital. We only have one dermatologist in Nairobi County. We asked them that you have a document called the staffing norms and standards. It says what a normal service should look like. Please bring the document to us so that we can know that they each say that level 4 should have 50 MOs. We can then let 10 work and 40 stay away. They refuse that because they know that even before the strike, there's severe shortage of healthcare workers in this country. And I'm so happy that the latest order from the judge ordered them that come to the court next time with the list of every hospital and how many doctors there, because he now wants to do it himself. And I can assure you, it will be drama in that court because there are some hospitals that have 0 doctors. So we must not come here and try to act like all of a sudden we care about these patients. We have begged as a union and asked, please, 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 patients must not suffer. Let's talk. All I want to say on this table, as I said, on this Eid, that we are ready to talk. The day the government walked out on us, we had a draft return to work formula that we had made, and we bounced it back both sides.
When is the next meeting?
The next meeting is supposed to be on 20th, right?
We did not walk
The
out.
meeting.
20th. That's 10 days away.
It should be,
No, the court, we are going to court on 17th.
on 17th, sorry.
That's 7 days away.
Yeah. So for us, I will tell you for free. Let me just, I didn't interrupt you.
Okay.
I want to repeat it again and again. KMPDU is ready to negotiate in good hearts. It is the government who have betrayed us thrice before, who has the onus on them to show a sign that this time when we trust them, they'll honor. Or they'll do what Dr. Alia said here. That last time they signed because there was an election. Next time they'll say they signed because people were dying. So at what point do we start trusting them? I repeat again, that doctors will only work based on trust. We only know how to obey authority. When you see doctors walking out of the hospital, when you see clinical officers walking out of the hospital, when you see laboratory officers walking out of the hospital, ask yourself, what is wrong? Normally, as scientists, when you see fish dying and floating on the pond, you ask yourself, what is wrong in this pond? Something is happening in this pond, and people are blaming the fish for being too lazy to swim. Not that there's something wrong in the pond. People are blaming healthcare workers for being heartless, for being unreasonable, and not asking themselves, what is wrong? He has said something so powerful that I wish you all remember. Governance. In WHO pillars of healthcare, after you have brought the drugs, brought the buildings and the machines inside it, after you have attempted to hire healthcare workers, the human resource, after you have brought the financing, the shift and the share that they talk about, you tie it a nice, neat bundle called leadership and governance. There's a challenge in the leadership and governance of this country, whether it is in devolution, counties, or national. And the most tragic thing that you will hear him say, that national we have done our part. County. But Kenya has voted for one president, one government.
But look
the
at
same taxpayer in Lamu, the same taxpayer in Machakos.
Look at the demands.
They all deserve the most
Look at the demands.
Where they lie more.
Yeah, look at the demands
I want
and
to ask
see
him a specific question.
a demand like failure to promote eligible doctors by the counties.
Yes.
As
We
you know,
went on strike against counties
But
and national.
we've agreed on 4. We are not going on the other demands. We're just
do we
talking
do
about
that?
the 4 fundamental, because
Yes.
what we need to talk about is how tomorrow
Yes.
you are calling off the strike and
Yes.
going. And I need to talk about that. But I need to go to Dr.
recurrent salary delays
Eh.
and failure to remit statutory deductions
Daktari,
and repayment of loans. We
never-
have repaid all of them.
I never heard that on the 4 bare minimum. But I'm coming to you. I need to ask you a very fundamental question before I go to Nikal, because now the next 10 minutes I want want to use it to see how tomorrow you can go back. We can find a solution here with these people.
Yes.
Don't you think at any point of the 28 days, at any point, at any day 1, 2, 3, 4, did you ever think you are unreasonable with your demands?
In my heart.
Did you ever at any point think this is so unreasonable?
In my heart and in our hearts, because it's not about Ms. Keller. If we were so unreasonable, do you think a cardiologist professor would be on strike? If you were so unreasonable, do you think that doctor who is a nun, Catholic nun who is a doctor, would be out of work? If you are so unreasonable, do you think we'd come from 19 issues to 10 to 4? If you were so unreasonable, do you think we'd sit in a meeting up to 2 a.m.? If you are unreasonable, do you think we'd sit down as government walked out on us?
Okay.
We are willing, even from this place, if you were to carry me into a negotiation table to sign, I will. In this phone, I have the draft return to work formula. We are ready to go to work anytime, any day, as long as government comes out of their strike and joins us on the table.
Okay. You don't feel unreasonable. Do you empathize at any point during this strike? Have you empathized that you feel the pain of your patients that can drive you back to the hospital?
My heart breaks every day. I want to tell you that my own father-in-law is unwell right now. We are fundraising to take her to a private hospital. My own mother had traveled to Nairobi for treatment and KNH was closed. She had to go back to come later. My heart breaks for my patients, not because I want to be clever for the camera, no. Because I know that when all is said and dusted, we will have our issues resolved one way or the other.
They will be resolved.
But those empty dinner tables will never be filled again.
Never. Okay.
Let me tell you.
I'll come to you.
Let me tell you.
Yes.
This thing of patients dying is a blackmail.
But it's the truth.
Yes.
It's the truth.
It's a truth, it's a blackmail. If the government felt so strongly about patients, as my colleague who is a doctor, he may feel like that. The simple 4 things they've been saying. Why are they saying, stop work, then we'll come to the table? The government would win big if they said, we are ready, come and talk to us and go to work. But if they're saying, before you go to work, we don't even talk to you, do they really, my friend Ken, do they really mean well? Just agreeing to start talking,
Just talking.
if that alone would actually get them to go back to work. And they keep saying, go back, people are dying, then we start talking. If they were so serious about that, I would find them, if I was. I've negotiated strikes. I've been a DMS, I've negotiated strikes. You go there in the morning, wait for the people, because you have something to offer. You want your people to go back and be treated. But if you sit, if you sit and say, if you want to talk to us, go back to work. Then,
but the things that we have talked about
just
that
talking,
have already
then
been
just
offered,
talking.
They are not anything.
Where were they offered?
What are
meeting?
they?
We have never had any meeting.
What I've had here is, if you post and pay later, we can consider. What have you offered?
But does it mean that it has to just be one-sided?
No.
So that we
if you
don't
have had
care
one, what have you offered? What has the government offered?
Good question.
No,
At
no,
least
no,
we
no.
have had
You know, we cannot keep on repeating the same thing.
There's no
you know,
offer.
over and
But
over and
Dr.
over
this is a
and
very
over.
direct thing.
Yeah.
We have said,
Of the four,
tell
what have
us
they offered?
in July you will pay us, and we are willing to go back. What is the government putting, not July, probably December, what is the government putting as a counter offer to that?
Your students.
Go back to work, people
Now,
are dying.
no. You see,
It's not a laughing
no.
It's not a laughing matter, Dr.
Well, when I
Jika.
cried, you said it was not a crying matter. When I'm laughing today, you are saying...
No, this is not a laughing matter.
Okay, so I think we probably are not we are not really moving towards.
No, we have made good progress.
No,
Yes,
we are not
from 19
moving.
to 4.
Yeah.
I even have, now we have narrowed to this. I even have suggestions on how
You
we
will
can
shortly,
pay
but
interns.
let's-
Now we can pay interns.
let's-
Because again,
You see now, let me tell you
we have
something.
narrowed
Yeah,
down.
let me tell you something, Ken.
Yes.
This is how it works.
Yes.
And Dr. Nyikal here knows. You cannot post an intern if you don't have a budget. That one he knows. You cannot. You cannot start saying that let us post today, then we will pay you in July, and you don't have a budget. It is illegal. Yeah?
You have a budget.
It
What
is-
you don't
it
have
is
is an exchequer release.
It is illegal to post when you don't have.
It is the exchequer release
No,
you
no,
don't
no,
have.
no, Dr. Nikal, there is no budget for this batch of interns. So,
In
So
other
what
words,
money are you
in
expecting
other
from
words,
If
you
we
are,
say-
it's not happening. There
yeah,
is no
if we-
budget for
no,
this
no, no.
interns.
Now,
It's not happening.
Now, Ken,
Yes.
this is
That
why
is the import.
This is why.
I'm
This
shocked
is
and disappointed.
This is
That's
why.
the import of what
this
you're
is
saying.
why I
The
said.
thing sounds worse
no, no,
than
no.
I thought.
This is why I said. This is why I said.
Yes.
I really wish we had a mechanism to engage and have productive discussions around this issue, because it is not a small issue. Yeah? But when we now come and then we start arguing and, we are trying to look like we are accusing each other, we are making allegations of walkouts that never happened and things like that, then we are not being objective, and we will not
Move forward.
What we need to do
Yes.
is we really need to become objective. We just put our minds together. In a CBA, which I used to understand to be the whole, when I was a trade unionist, a trade union leader, I understood a CBA to be a platform that can enable both the employer and the employee to come together and work together towards a common objective. That is how I understood it. And the Labor Relations Act 2007, Section 78, actually identifies some areas that are not allowed. Strikes are not allowed. I don't know if you are aware of that, Dr. Nikal. Yeah?
That strikes are not.
Yes, employees in essential services are not.
You have to define essential services.
Labor Relations Act 2007,
And 2010
Section
Constitution,
78.
Article 41, which is more supreme to that act.
And also Article 40.
Kenny, the lawyer will tell us
Yeah.
the Constitution and the act really
But
is
anyway,
superior.
we've
And
gotten
you have to
into, we've
define
gotten into,
essential services.
we've gotten into
You
the
just
argument
walked us
again.
into it that time.
No, we've
Yeah,
gotten
you walked
into
us
it. I
into
was
it.
just explaining,
Yes.
yeah? It actually prohibits strike in essential services.
Yeah.
Now, the understanding here is the union has a lot to gain from that particular provision of the act. Because whereas it says that you are not allowed to go on strike, it also recognizes the fact that this should not prohibit you from advancing your interests.
Yes, under the law.
So there is a way in which you can be able to advance your interests in this collective bargaining arrangement without going on strike, because your strike is equal to loss of lives.
What options did they have that time? Just explain that to
Yes,
me.
I read
What
the ILO
options?
principles.
Good question.
Yeah, what
Good
options
question.
did they have?
Good question.
Yes.
Now, I started off in the beginning by saying, when you are in a collective bargaining arrangement, you need to find ways of talking to each other and convincing each other. Sometimes you need several ways of being able to make strong cases that will convince the other party. You need to do your homework. You need to come up with strong justifications. You need to come up with data to back up what you're saying. You need to come up with ways of being able to get what you need. You need to negotiate, You don't now start forcing and saying that for as long as you're not giving me this,
What I want.
I will be out of work. Patients will continue dying. You are the one who is on strike. And until you give me this, then we will just not move ahead.
Okay, okay.
That is not a good way of
But do you agree
negotiating.
before you get to that point,
Yeah.
you must have really tried to push?
7 years waiting.
Before you get to that
7
point that
years.
I want what I want, and if you don't give me, I'm not
7
going.
years.
Don't you believe, having been in the union, I mean, you
options do you have?
the foremost members of KMPDU.
Yes,
having
we are
been
the
in
ones who
union,
actually founded it.
Don't you think before you get to the stage that you tell the government, unless you give me what I want, you must have pushed? You
I
must have
want you
pushed.
to do an audit. I want you to do a very genuine audit of what has happened between 2017 and now. Okay? Let us not talk about it now. Just do your homework, talk to Ms. Keller, talk to everybody else, do a nice detailed audit.
Based
of
on the
what
CBA.
Yes,
Based
on the CBA. What has happened from 2017 to
until
now.
Okay,
You
gentlemen,
will be surprised.
My director is on my ear and she's giving us only 10 minutes to conclude. But Dr. Nikal, yes.
I'm a bit unhappy that we narrowed this discussion so much, and we didn't even achieve why we narrowed it. We narrowed it to the point that what can we do to get back to work, which was good. But at least the doctors, in my view, gave us 4 things that they are willing to talk about.
And go back to work.
I would really try to persuade the executive that drop this thing that we can't discuss anything until you go back to work. Because then you really don't care about the patients. So let them agree to go back to talk. At least go back to talk. And the 4 things that our colleague has said, let them be discussed. Kenyans are dying. When we do that, and at least the government and the doctors agree to talk, then we'll come to the bigger issues. You know what we are doing? We are picking bodies from the water that are coming down floating. We narrowing this thing, we are not going to find out the cause. I have a lot of solutions, even in my mind, even this definition of an intern. The law has defined it, we are trying. Now we are narrowed that all interns, we want them just to be employed by the government. We may then even have add ways of suggestions. We can say all level 4 hospitals, whether private or what, must have the facilities. You know why we define level 4? They must have the facilities and the senior staff so that the interns can work there. And then we agree on what they should pay. Then whether it is a private hospital, whether it is a government hospital, whether it is a county hospital, if you have made that possible, the interns will work there. So that is not just the Minister of Health looking for this money. Remember, there will be many, many interns coming because you don't want it to bring much, but I can tell you more will be coming because the Commission of University Education has removed the regulatory body from regulating a number of interns that come out. Now, I know you will say that is not taking us to work tomorrow.
But this year they were less than last year, right? Yeah. The ones who are supposed to be posted.
Yeah,
So
there are many more this year than last year.
Let me summarize by saying, get the 4 things, the basics you want. Let the government also agree to come to table without saying stop strike before we come to
I think number 1 and 2 are pretty done.
Yeah. So
it's pretty easy.
Then once that is done, then let's come back and say where all this has come from. Well, if you have counties that are being paid, that are being given money by the same, why are they having different structures of payment? Because the regulatory function, which is of the ministry at KHRAC level, is not working. But I'm very cautious, be told me, just work on things which will stop the strike. But even if we stop the strike, all the others must be brought in. We have 6 pillars, and we are discussing just one.
Okay.
Health, human resource. We haven't gone to finance. We haven't gone
don't go there.
So I'm not going there. But please, the 4 things they have said, the government say, let them go back and talk, and we will then come in. No, there are a lot of people who know a lot of things with experience. Then we come and say, how do we stop this? Basically, what we have is a broken health system.
Okay.
With strike being the biggest symptom of a broken system.
I want to end the discussion tonight, but I want to bring up something that is just shortly. He said that there is no budget for interns this year. They are saying pick the letters. You're being posted. He's just confirmed there is no budget. What is going to happen?
It is my closing remarks.
No. I'll give you a closing remark after this. Yeah.
Although I said,
yes,
you cannot post without
a budget. And then I asked, and he said there is no budget for these interns.
For salary.
There's no budget.
What we have looked for is a stopgap
which is a stipend,
measure of about 2.4 billion.
Okay.
Which is going into paying them stipends, just to enable them to, those who cannot afford.
The reason why I brought it up, because it's one of their minimums, right? Because they think this is in the CBA and must be implemented. That's why I brought it up. I understood your point.
This stipend thing must be stopped. You know, we must say we are employing these people as workers. And if there's a gap in their payment, how that will be addressed. Don't reduce them to non-employees who you are giving stipend.
Okay.
It gave us a problem with the registrars. I told them way back 2000, don't allow registrars to come because they don't want to be paid. When their number got large, they started demanding.
And that is the problem. That is the problem.
That's why I
was going to ask him, you see, if we now say, you know, sometimes when you go to negotiate, that's why I say we need skill.
Yeah.
When you go to negotiate, you also have to know how you're prepositioning your negotiation. When you go to say that we want money to pay employees, then you will be told, how many employees
do you have right now?
How many? You see? So now you are told, can you limit the number of these employees? Now we are saying that the interns are employees. Can you limit the number? You cannot just take all of them, because even you in your house, if you wanted someone to come and work there, you can be able to say, this work, I need 2 people to come and clean this house. So you find people walking out there, you tell them, Munyinyi wawili kuja, come and clean. But now one day you are told, today there are 25. Take all of them and pay them a certain
just say one
amount of
thing.
money.
Let me just say this.
How does it work?
Ken,
Yes.
this what he's saying in governance is grave. Let
How?
me tell you, if you talk about the number of interns coming out, this country has a cabinet. And in this cabinet, there's the Minister for Education.
Yes.
And there's a Minister for Health. And there is planning. We must be able to know next year how many are coming.
Yeah.
And that is what you come with us on the budget.
Okay.
You know, let me just talk about this numbers.
Yes, briefly. We need to close.
First of all,
yes,
just to quickly disabuse or say, you cannot say you want to have people to help you in your house, and you call 30 people when you hire one, then they ask you to give them fare back and tell them, no, I can't take all of you. They trained them knowing how many they take. But let me tell you about disabuse the numbers. The Public Service Commission establishment for interns at 2,000 for doctors. All interns, nurses, and CEOs is almost 9,500. Even up to now, we have not even passed the half mark. So the numbers are not an issue. Secondly, even if we employed every single doctor who graduates in this country, it will take us more than 50 years to reach the WHO ratios, assuming no doctor dies, retires, or leaves. But more importantly, Kenyans don't reproduce. Get that? So the numbers are still needed. We still need to train more, hire more. Thirdly, the budget issue. Now let me tell you that finally the cat is out of the bag. We knew this from day one because we have our people inside MOH, because some of them are parents to interns and doctors. Ministry of Health did not adequately defend the budget for internship.
Okay.
And in a country where there are competing interests, something will be dropped. And internship under training was dropped. That is where the problem came. And instead of fixing this problem, you start blaming the doctor. You are a student.
They call them students.
Yeah, what? All those things. Because they're not being genuine. And you tell me that.
So they didn't ask for the money.
Yes.
Now
And you blame them.
No. Those are now
It's a governance
allegations. No. That is
It's a governance
those are now.
issue.
You know, those are now
We
semantics.
need to
Now,
end.
let me
Gross
tell you something about the numbers. I want to correct Ms. Keller. Yeah. When the Public Service Commission provides for staff establishment, you cannot go and now request for a budget for the whole 9,000.
But you can plan within that 9,000.
Yeah, you cannot go and request
You can
for.
plan
Yeah,
within the 9,000.
you request for
So-
actual numbers. You get actual numbers. Now, what is the problem here? And I think I really liked what
Dr.
Nyikal said. We need to have visibility of the numbers.
From
You see?
first year.
Yes, we need to have visibility of the numbers. But now, that is where we need to connect. You know, from the Ministry of Education, how many interns do we expect to come out so that we can be able to budget
for
adequately?
them. Yeah.
There is a gap there. So you see,
Governance.
Governance.
Mijungu,
Governance.
we are talking about the same thing, all of us.
Okay.
We are saying the same thing,
okay.
but we are
If you
just...
agree with us on
but
governance.
we are just... No, I'm not saying... You see now you're putting words into my mouth. But
just-
we are
just
speaking
close your
different...
mouth.
We are, no. We are speaking different languages. And we are actually actually also being a bit, we are not doing it with the kind of
Decorum.
decorum that
You
is
expect.
required. But it is something that if we sat down
Yes.
and we looked at it properly,
Yes.
we would be able to
Find a solution.
resolve.
Yeah.
The only problem I have with that is, even as we try to find this mechanism of sitting down in an organized way to resolve, can we have the patients getting the services that they need?
This is where I
That's
end the
it.
show tonight. And I'll begin with you, Daktari. We need the doctors back to the hospital tomorrow. Will you cede ground and go back to the hospital and begin talking with the government? Will you do that?
I will give my closing remarks.
Yes.
How I replied and rehearsed for it.
Like a poem. Go
Yes.
ahead. Yes.
A marriage occurred in this country in 1963. A marriage that sadly, in 2010, ended up in a divorce where there was a national government and a county government. But in this marriage, there were children who were born out of it. These children have been in school. And these children have been saying that they don't have fees and pocket money. When they go to their father, the father tells them, go to your mother. When they go to their mother, the mother tells them, go to your father. County tells you, go to national, there's money stuck there. National tells you, we have done our part, go to your counties, we are devolved. At this point, the children have said, enough is enough. We'll simply stop going to school. Please, don't blame the child for not going to school. Ask yourself, have you bought uniform? Have you paid school fees before you blame this child for not going to school? That's the same thing the healthcare workers are telling you. Do not blame me for not going to work. Ask yourself, national and county, have you facilitated them to be there? Just the way you build the hospital, buy the drugs, buy the machines, also facilitate the doctors and healthcare workers to be there for their patients. That is all I can say this evening.
Thank you. Because you check the Ministry of Health in Parliament, I'll allow him to speak, then you close for us.
So I'll just say this, Ken. I think the issues that have been raised, these are issues that can be sorted out. I don't see anything complicated in the 19 to 22 issues that have been raised by the union. These are things that can be sorted out. Now, I just want to really assure you and even the union and everyone else, we have always been available, even outside of the whole of nation approach arrangement that was convened by the court. By the way, this one was convened by the court, and the court gave 6 orders around the way that whole of nation arrangement should be addressed. And I think the bone of contention arose because one of the orders was not met, the one for suspending the strike. And so it became difficult for the whole of nation committee to proceed. But we still have another arrangement where we have a conciliation process under the Ministry of Labor. We have submitted ourselves to it. We participate in it religiously. We can be able to progress issues under that conciliation process. Even outside of those 2 processes, our offices are open. We can meet anywhere. We can progress these discussions. It is not a must that we have to meet on a table, on an official table, so that we can be able to resolve some of these issues. We can actually discuss them anywhere. We can progress them so that we can move faster towards a resolution.
Okay.
But finally, even as we do that, I really want to reach out to our colleagues who are out there on the street. Please, for the sake of the lives that we are losing, for the sake of the families that are losing their loved ones, for the sake of the patients who are suffering without treatment, and even for the sake of our doctors themselves who are out there on the street. I've been seeing them coming even to Afia House, demonstrating every day. We don't really want to have doctors on the street. We want to have them in the hospitals. Let us sit down and discuss. Let us go back to the hospitals. We will sort out these issues. Let us go back and discuss them as our patients are receiving services. Thank you.
Thank you, Dr.
Mine, the doctors have told us through him that they are basic. He mentioned 4, there may be more, that they are willing to discuss and put on the table as a return to formula. I will ask the government, the executive, please, these things that we can't talk until you stop the strike.
No, we are available to talk.
Yeah, so let them talk and let them put this and then get the crisis. But the bigger thing, we must look at why we have a breakdown in the six building blocks of the health sector. We are only struggling with 1. So we must do that. And the issue of governance should be looked at, because even the disharmony between the county government and the national government need not be there. There is a structure known as the Intergovernmental Relations Technical Committee. I don't know how well it is working, so that all counties should actually be working harmoniously and should be at the same level if that was working. And if necessary, involve other stakeholders into this so that the whole country will really benefit. That is mine.
Dr. James Nikal, Dr. Dennis Miskela, and Dr. Sultani Matendechero, thank you so much for coming tonight. The country has been watching, the doctors have been watching. All we want is a solution on the table so that when we come, we wake up tomorrow morning, we are not reporting, because KTN has been going around the country and reporting on the health situation around the public hospitals. It's something that we need to ponder and think about. But thank you so much for coming and discussing this tonight with us, and looking forward to a fruitful deliberation when you sit on the table. Asanteni sana. And on behalf of the whole team, I want to say thank you so much for watching. Have a good night. We get another opportunity to do this next week, same place, same time. Have a good night. My name is Ken Mijungu.